Hello everybody. In this video I will talk about the gradual exposure and why it is a gradual exposure and not a normal ERP or a normal exposure and response prevention. So everybody who suffer from OCD, or he is a therapist dealing or treating OCD people, he knows that ERP is the golden therapy. ERP is the most famous and the most researched therapy, and it has the most reputation in this field. So ERP is the golden therapy, but but the problem with that is that ERP is based on fear, on confronting your fear and stopping the ritual. And a lot of people, especially people with mental rituals, they neither want to confront their fears, neither want or can stop their compulsion. Sometimes it is more difficult. So it is more difficult to confront these fears, like in harm OCD, because if he is afraid to harm his children, or in blasphemy or religious OCD, he even don't want to go into the ERP therapy because, as you know, in overflooding ERP therapy, so when they the therapist in the hospital will expose the patient to the trigger or the things that he is afraid of. So in religious OCD, that means he should write some text or be confronted with some text or images that is against God or against his God, or and like that. So this will be very difficult for him. So a lot of people will stop the therapy. A lot of people will stop the therapy because they cannot confront, they cannot face their fears, and if they face their fear, they cannot stop the compulsion. So in fact, a golden therapy is not the ERP anymore, but what I am using, especially in these films, but also in my private practice, what I use is a gradual exposure or gradual ERP, let us say. In a gradual ERP, there are 2 points. The first is that the facing or the confronting of the trigger of the object will be gradual and not sudden and not in its full extent, like in flooding exposure. So that means that we will begin in steps in confronting and also steps in preventing the compulsion. It will not be in a fixed full extent exposure. Okay, another problem or another difference between a gradual exposure and the normal ERP is that we have a problem with when OCD sufferer has multiple OCD or multiple OCD subtypes. Or multiple type of obsessions in different subtypes of OCD, then in this case, using the normal traditional ERP, like what is used here in the Netherlands in hospitals, then they will try to begin to focus first on one OCD, and they try to treat this type of OCD. Then they will go to the second subtype, and then if they are finished, they go to the third subtypes, and like that. But the problem here is that with the multiple OCD obsessions, is that there is dynamics here. So if he has a harm OCD and a dirt OCD at the same time, then when you work when the therapists work on solely on the dirt OCD, unaware of, or he is leaving for the moment, leaving the blasphemy OCD or the religious OCD or the other OCD, the harm OCD, then he is focusing only on the dirt OCD. He isn't aware that the other OCD types are affecting this or preventing or make the therapy slower than normal, because the interchange and because the inter-effect and because the dynamics between the two OCDs. But with gradual exposure, it is different. So in gradual exposure, in gradual ARP, or in fact in RP, because so I want to say that the secret is not in the exposure. The secret is in the response prevention. Okay, so we should call it RP, response prevention, and not ARP. Okay, for the to be more obvious. Okay, for the clarity. Why is that? Because if you like I have said now, if you have multiple obsessions in different OCD types, then it is better that you work from the moment, from the now, from the here and now. So you don't go with your you don't go with your foot to the exposure, to the source of the OCD, to the obsession. No, you simply live your life, and any moment, any time OCD comes, then you will do the 3 steps or 2 steps or the 4 steps. That means you recognize the obsession and then you refocus. This is the 2-step version. Okay, because sometimes I don't use the 4-step or the 3 steps version, but I use the 2-step version, with a lot of clients, in fact. Okay, so first you relabel, you tell yourself this is OCD, and then you refocus. There is another problem or another difference between the internal ritual OCD and the external ritual OCD. Okay, with the internal ritual OCD, or the internal OCD, or sometimes they call it pure O. In fact, it is not pure obsession. In internal ritual OCD, it is not pure obsession. You have a pure obsession, and you have also an internal compulsion. But because these compulsions are these triggers and compulsions are internal, so you cannot recognize them with your eyes or with your senses. Okay, you cannot smell them or hear them or see them. Then they called it pure, but in fact it is not pure obsession. Okay, so this is for the information. Also the third difference between the internal OCD and the external OCD, I mean by internal OCD, as I have said, the internal obsession and the internal compulsion. So your compulsion will be internally, will not be visible for the eyes, and also the compulsion. So the obsession, the trigger, and the compulsion will be in your head, while in external ritual OCD, the obsession or the trigger, most of the time it is outside, but it can be also inside. But your compulsion is always outside. So that means that with internal OCD, you don't have to be in a specific place, in a specific time, in a specific environment to get the triggers, to have the triggers and to have the compulsion, and to do the compulsion. While in external OCD, most of the time you need a specific a specific environment, a specific state environment, a specific places, a specific things. So things that it is specifically determined, and it is also outside of you. like dirt, like many other OCDs, which you can see the trigger, hear the trigger, or touch the trigger. Okay, and your compulsion will be washing your hands, so it will be outside. It will be external compulsion. Now, with internal OCD, because the obsession and the compulsion is inside your head, avoidance, okay, so avoidance will be continuous with you. You will be more likely in a continuous avoidance of the trigger and of the compulsion, because everything is inside your head. But for the external OCD or external compulsion OCD, then maybe sometimes he's busy with the swimming, with working, he's very busy with working, is very busy with the swimming. He don't get confronted directly and severely and harshly with the trigger. He will forget the trigger for a time, for a while, okay, until he is faced again with the trigger. But at least the trigger and the compulsion is not in his head, so he will not be really in a continuous avoidance. Why? Because in this street there is no dogs, in this street there is no dirt, in this room there is no dirt, so I don't have to be afraid, or I don't have fear. I don't have a trigger, so I will not have a compulsion. But okay, so more likely, I don't talk in extreme here, so okay, yeah, of course there are some types of dirt OCD which is also have to do with mental rituals, okay, mental rituals and mental, but most of the time the dirt OCD or other external OCD, you will see very obviously it is, and you will see that obviously that their compulsion are external and not internal. So the problem of continuous avoidance now when the OCD sufferer has the obsession, the trigger inside his head, then how can I use exposure here? He is exposed all the time with the trigger. All the time he is busy with the trigger. The trigger is very near to him. It is in his head, not like the external OCD, which most of the time the trigger is outside and the compulsion should be and will be outside. So now with mental ritual OCD, now when he is in continuous avoidance, so he is in a continuous trigger, he is with the continuous trigger, I don't have to send him to the trigger, I don't have to expose him to the trigger. No, now the accent, the stress will be on the point of response prevention. Okay? So now he should learn response prevention. Okay? In our method, okay, in the method that I am using in my videos here, and also in my private practice with my clients, I am not only using, in fact, a gradual exposure, but a gradual response prevention, or gradual ERP, what you want to name it. I don't use response prevention, but refocus. Why? Because response prevention most of the time is not enough. Because in response prevention you are talking about not doing the compulsion, but not doing the compulsion leave the mind empty to. So you have two halves. The first half is response prevention. You have stopped the response, but the other half of the brain is still busy thinking. What should I do? What maybe this is not right to stop the compulsion. Maybe I should continue the compulsion. Maybe I still feel the fear. I still feel the terror of the obsession. Why shouldn't I do the compulsion? Why shouldn't I do? Okay, this is with response prevention. So, but with refocus, we will fill the whole glass. So first we will stop the compulsion, and for the second half of the glass we will fill it with another trigger, another thing that you should refocus to. So you don't only stop the response, you prevent the response, but at the same time you are busy with something else. This will fill your mind, your brain, because we have differentiated between mind and brain. We are using different terminology in our films between mind and brain. You should see the series from the beginning, and I also want to remind you that it is very important to follow the video playlist in the correct order or correct sequence. I.e., you begin from the first video and you proceed to the second. Another difference why the refocus is better than the classical ERP is that the OCD patient is already in a great fear. So if you tell him to go to the trigger, then he will have a lot of reluctance. He will be reluctant to do that, and eventually he will stop the therapy. And also another thing is that with ERP, so in OCD therapy, everybody knows that the more the client consider his obsession or his compulsions, especially the obsessions, trivial or have no value or have less weight or no weight, then the more he will get quickly in the recovery. Okay, he will recover quickly. So there is an internal contradiction in ERP in that we tell the patients go expose yourself, go to the exposure, go to the trigger, and at the same time we say to him that the OCD obsession is not important. You should not be afraid of it. This is a contradictory message because how is it possible that you spend so much time and you let the patient walk with his leg going to the obsession to expose himself, and at the same time you tell him this is not important, the obsession is not important? Of course you are giving the brain a wrong message. You are giving the brain not the correct message. The brain do not talk languages, do not talk English or another language. The brain talks the language of behavior. When the brain is watching you, when it sees that you are going to the trigger, you are going to the obsession, you are struggling with the obsession, then the brain will get the message that the obsession is important. You should pay attention to. You should consider it. And this is not good for the therapy. While in refocus, the exposure comes naturally. You don't have to go to the trigger. The trigger is coming to you. So you are inside your office, you are working, and suddenly comes an obsession. What you will do, you will recognize that, so you will relabel it or label it in the beginning. You will say it is an OCD, then you will try to refocus, or maybe you will relabel it and then you reframe it. You will say this is not me, this is the OCD, and then you will refocus. This is more natural. Then the patient will not stop the therapy. He cannot stop the therapy because now the therapy is his life. Now he is practicing the therapy inside his life. So this is why you cannot escape from me. You cannot. Now maybe if you come to my private practice, I do with you an exposure response prevention, then you will see, maybe you will feel that it is very hard. No, I cannot do that. It is against my religion, it's against my thought, it is against my... Okay, so you will cut the therapy, you will stop the therapy, and you will go away. But now, with this method that I'm giving in these videos, you cannot stop the therapy, because the therapy is for you and by you and with you, and it is a natural thing. Because now what is the problem? You don't have to go to the therapist, to the therapist office, to the therapist room. You don't have to go to there. No, inside your office, inside your work, inside the swimming pool, inside the kitchen, inside the family room, with your wife, without your wife. Okay, now you have a problem. You have suddenly an obsession. So what you will do, you will recognize that. You say, like a radar, you say, oh, this is an OCD. So you don't let the obsession grab your attention. No, you step backward. So why you step backward? So that you cannot control thing if you are in it. You can control thing if you are outside of it. Then you can avoid it. So you can say this is an obsession. But if you don't have this step, so suddenly you are completely engrossed in the obsession. You cannot go out, because you are in the film. You are completely engrossed in the emotion, in the fear emotion, in the story of the film. In the film, you cannot say, "Oh, I'm watching a film now. I don't have to be afraid. It is a horror film. I don't." No. But at the beginning, I will say to you, now you will have a horror film. Now you can say to me, "No, I refuse to enter this film. I will not enter this film," and then you will stop the chain of the emotion, of the negative emotion. So this is why it is important to recognize, oh, first step, oh, this is an OCD. Now you know that you are now inside a bubble, or if you touch, then if you go a step forward, so if you go toward the OCD, struggling with him, discussing with him, try to negotiate or to push or to be against the obsession, then you are touching this electricity wire, then you are shocked. Even if you touch it very, very, very small, there is no difference between touching it small or heavy. You put a heavy push on the electricity wire. If you touch it very small, then you will be shocked. If you touch it very strong, then also you will be shocked. But now I'm telling you, this is an electricity wire, so do not touch it. You will have more controllability, you will have more control to say, okay, this is an OCD, now I know all of my feelings and thoughts are fake, they are not me, they are the OCD fear and fake fear. Okay, so this is not me, and then it will be easily to refocus. Okay, so now it is natural, you cannot escape the therapy. The therapy is everywhere. You should only do it. And you cannot escape do it, because if you escape the therapy, OCD have no mercy. OCD will increase and increase. Now I will give a small example to the people and to show the difference between a normal ERP and refocusing. So let us say you have a dirt OCD, and then you see the knob of the door, and then you think, at the moment you look to the knob of the door, then you will say, oh, there is a dirt maybe. Okay, now it is very straightforward. They will tell you in ERP, okay, go to the door and touch it, and of course you will be very resistant or reluctant to touch the door, but they will force you, or they will tell you, try to do that, and sometimes if you don't accept that, they will tie you and they will put dirt on you. But now, okay, so I will give you another example. Let us say you are sitting in your office, and now you are attacked by religious thought. Okay, and then at the same time you are attacked by harm thoughts, so harm obsession, harm OCD. Now, what you will do? What shall you do with the ERP or with the? So in this, of course, it is now not. I will try to summarize. So I will not get in details in that, because there are another films for that. But now at the moment, which come before? Is it the harm OCD, the harm thoughts, or the dirt, or the religious thought? At that moment, you try to relabel it, and then reframe it, okay, and then refocus it, or relabel it and refocus, okay. And now, now this was with the religious thought. If after that, after 3 seconds or 3 minutes comes the harm thought, then also you will relabel it. So you will say this is OCD thought, or this is a OCD fake thought, or this is a harm OCD thought, or okay, or this is OCD, simply this is OCD. And then you will say this is not me, this is the OCD, and then you refocus to your desktop or to your laptop, and you begin the work, and you should be engrossed in an activity that takes all of your attention and your focus. Now, if you say to me that after I have refocused, I still feel the pain, I still feel the fear, I still feel that I am that the anxiety inside my chest. So what shall I do? I will say to you, you are again focusing on the fear. I told you to refocus on another object, on what you are doing, what you are seeing, watching film, working. Refocus that. At the moment you refocus at that. At the moment you refocus again at the pain. So you say to me, or you say to yourself, but I'm still feeling the pain, I'm still feeling the anxiety, I'm still feeling the fear. Then you are focusing on the fear, okay? But we told you to focus or refocus on another activity, okay? So try never to refocus again on the fear, again on the anxiety. We are trying to let you refocus outside the anxiety, outside the pain, outside the fear, okay? So this is simply a summary of the difference between external ritual and internal ritual, and of course between ERP, the classical ERP, and refocus. Okay, God bless you and take care.